Hi guys, good day. I'm Dr. PREMNATH, Senior Resident from Department of Community Medicine, SLIMS. So today our interesting topic of discussion will be on dengue virus infection. So I have designed my content of speech on problem statement about this infection and epidemiological determinants, clinical manifestation, and what is clinical features with prevention and control strategies. Now we'll go into the successor slides. So when we see the problem statement of this infection at the global picture, this infection causes 390 million infection per year. So the number which is depicted is in millions, and around 90% of the infection population are in less than 5 years of duration, and of which 12.5% meets the unreliable reality of mortality. So, and this infection is not reported a decade ago or in the last year. It was reported even in the 19th century. Okay, there are many outbreaks in India, in different parts of our region. And first outbreak was in Kolkata. And a century passed, but still the effective control strategies are not yet designed. So we are facing many mortality because of this infection. So to know about this infection in detail is important because of this. And WHO stated divided our Southeast Asian region into three categories. One is category A, B, and C. And our India fits in category A. And what this category indicates is that if the region or the country falls in category A, means the infection is hyper endemic in that region, that it is constantly present and it is infecting the population. And category B countries indicates the infection is sporadic and outbreaks are also rare. In category C countries such as North Korea, the infection is not yet reported, even a single case not as reported. See our neighboring regions, India, followed by Bangladesh, Maldives, Myanmar, Sri Lanka, Thailand, all our neighboring regions are hyper-endemic to this dengue infection. Okay. And when we see the problem statement in our own country, you could trace the figures which I projected here. See in 2009, the number of infections was 15,000. And it progressed from 2015-16, and see at the end of the 2019, the number of cases reported per year is 1,57,000. Where the number 15,000 stands and where the number 1,57,000 stands, it is 10x, 10 times the infection has increased. So this is how the problem statement. The disease is gradually improving. Why this increases there? Because of rapid urbanization, poor infrastructure facilities. And if you see in detail about the epidemiology, you will understand why this is increasing. Okay. So when we start about the epidemiology, we'll see about the agent, host, and environment, and how this disease is transmitted. When it comes to transmission, this disease is caused by an agent. It is a viral infection by a flavivirus. Okay. And based on its antigenic and biological capacities, it has been divided into 4 serotypes. Serotype 1, 2, 3, and 4. Okay. And a person is infected by an infection in his lifetime. There's no chance that he can say that he will not get the infection once again, like in chicken pox. He might get the infection even in second or third because of there are 4 serotypes of this. And once he faces such a situation, there will be catastrophic facing, that is, the severity of infection will be more. He may face the complications like dengue, hemorrhagic fever, and dengue shock syndrome. It all because of preformed antibodies. Okay, so it's like a person may get multiple times infected by dengue. Once a person is infected, only for few months the antibody remains. Okay, so if he's happened to be infected by another serotype, he'll be facing the consequences of complications because of this disease. Okay, this virus, how it is transmitted to human? It is by a vector. The vector is Aedes aegypti and Aedes albopictus. Okay, in Aedes aegypti, if here I depicted a picture where the mosquito is uninfected, consider, and if the mosquito faces a person who's infected with the dengue virus, in the period of 1 day prior to the illness, to the 5th day of the illness, anytime the mosquito bites the infected person, the mosquito will be infected. For a period of 8 to 10 days, the virus replicates in the mosquito and the mosquito remains infected lifelong. And there's a transovarian transmission to the next progenies. So once the mosquito is infected, till its life cycle of 2 to 3 weeks, it will be remaining infective, and it will infect many other human population, and its progeny also will be infected because of this virus. So it is considered this mosquito is now infected. Now it meets the healthy population in the community. Okay, it will by the it will cause the transmission of flavivirus into the healthy person, and the healthy person will be infected. Now this healthy person acts as a reservoir for the uninfected mosquito to get infected. So this cycle continues and the number exponentially increases. So we are meeting a large number of cases. So the main thing concept is if the Aedes mosquito bites an infected person, it remains infected for lifelong. And the persons whom the mosquito is coming in contact will all be infected because of this virus. So when we come into the vector biodynamics in detail, Aedes aegypti is a domestic mosquito, highly domesticated, and it is found in our residence, near our residence. And the flight range of this mosquito is 400 meters. Why this number 400 is important? Because the range, if a case is reported in your residence, or say if you are a medical officer in an area and case is reported, okay, you need to make a thorough surveillance of any other cases is present or not within the periphery of 400 meters radius. And in airports, this 400 meters will be kept in strict surveillance that there's no vector for dengue. So if a case is reported, we should make a strict surveillance of 400 meters radius around for any other new cases of dengue. So because this mosquito will have a flight range of only 400 meters. And when you come to characteristics of this mosquito, it is anthropophilic, discordant species, endophilic, endophagic. What does this fancy term indicates? It's an anthropophilic, that is nervous feeder. It bites the human population multiple times, okay, to fulfill its blood meal. Okay, for this blood meal, it will have a nervous feeding over multiple humans in order to satisfy its meal. And what is meant by discordant species? With one meal, it will not complete its genotypic cycle. It needs at least multiple meals to complete its in a genotypic cycle. So what this importance of these two terms, anthropophilic and discordant? Once a mosquito is infected, it will bite multiple persons because in order to satisfy his meal, okay, meal satiety, and it will so the human population who are coming in contact will be infected. And next two terms, one is meant by endophilic and endophagic is it resides in the indoor walls. It rests in the walls of our houses. And it's mostly in the indoor content, not as in wild mosquitoes, which is in Mansonia, for example. It will be in the fruit, in the leaves. But it is not like that. This dengue, that is vector Aedes, will be strictly an indoor resident where it takes its blood meals. It will complete its genotropic cycle. Only for the completion of genotropic cycle, it will come in contact with the external environment, and again it comes to the internal environment. So it is endophilic and endophagic. Okay, and more importantly, the important characteristic of this vector is it is highly vectorogenic, highly antigenic. It contains once it's infected means it will cause the virus to replicate within it, and if it bites 100%, means there's a chance of infection will be 100%. So it's highly vectorial. And when we compare to the Aedes albopictus, the important characteristic difference would be it is a concordant species. So the term concordance indicates that it will complete its blood meal within, if it bites a person, okay, it will complete its blood meal within that person. So there will be not multiple bites to complete its blood meal. So when we see the characteristic difference in Aedes albopictus, it will bite many humans in order to complete its blood meal. But albopictus will have its meal within one or two persons. So there will be a cluster of cases in aegyptis, and there will be sporadic cases in albopictus. And albopictus most probably will be in the borders, or will be, can we say that it's not in strictly in resident areas. HFD, if there is means, it will be strictly in resident area, that is urban population, and the cases, if it is reported, will be in clusters. In albopictus, it will be in periphery, and the cases also will be sporadic, not in clusters. And where this mosquito breeds, whether it is in clean water, yes, it is in clean water. Even a single drop of water is enough for this mosquito to replicate. Okay, so after a period of rainfall, okay, monsoon season, if we happen to have a rainfall, that rainfall water is more than enough for this mosquito to become active. Okay, and because of our usage, for example, I have depicted pictures below. You could see coconut shell, used unused glass jars, used tires, and some utensils, and sunshade, tree bark, where all the chance for water collection is high. So if the mosquito breeds in this place, there's a chance that there will be a lot many of population of mosquitoes, and the persons who are residing close proximity of this area will be infected of dengue. So once we have a tea cup, for example, we are going to a tea stall and having a tea, it's our duty to make sure that it may not become a reservoir for the Aedes vector. For that, we should follow a proper disposal technique. Okay, for some same in a tender coconut shop. Okay, just like that, if you throw that tender coconut shell, it may be a chance for water collection, and the mosquito breeds will, and ultimately we will be infected of this infection, dengue. Okay, so this is about the vector bioinformatics. Now we will come to the entomological surveillance. Once a case is reported, there are three parameters we can say whether this area is highly infected or of low risk chance. By these three parameters, we can point it. What are the three parameters? One is house index. Okay, next is container index. Third is Brito index. House index means, as I said, depicted here, the numerator will be number of houses infected. If you're going to survey an area of village of 100 houses, and we see the 10 houses has been infected by a dengue. So in numerator will be a 10, number of houses infected will be 10. The total houses surveyed will be 100. That it will come the percentage will be coming around 10 percentage. Okay, if it comes around 10 percentage, it is a high risk area. When we come to container index, the numerator will be number of positive containers divided by number of containers inspected. For example, same area, that's 100 houses we are going and checking for any unused utensils or any waste containers which has the water collection site and larva is present in that container, means that is a positive container. Okay, so for example, we are inspected 500 containers, of which 50 containers contains the larva. In that case, 50 will be our numerator, a number of containers inspected will be our denominator, and if we calculate the percentage, it will be coming around 5%. Okay, that 5% will be in high risk. When we come to Brito index, okay, it is nothing but number of positive containers divided by number of houses inspected. For example, the scenario which we discussed now, there are 50 containers positive now, so numerator will be 50. Number of houses inspected will be 100. Of 100 houses, 50 containers are infected, means 50% is the Brito index. So it is also high risk. So when can we call an area as low risk? Means house index should be less than 1%. Container index also should be less than 1%. And Brito index should be less than 5 per 100 households. If this is the percentage, means we can call the area, that is the area allocated to us, as a low risk area for dengue. If the number is in the other range, it is a high risk area. For your practice, I have depicted here a scenario where after a rainfall in an urban area, we are going to inspect 100 houses for the presence of larva. And our team has identified 10 utensils, 10 containers. Okay. For example, it may be in broken, unused mixie jars, tea cups, coconut shell, of which 3 containers contain the Aedes larva. So, will you call this area as a high risk area or low risk area? I am telling this area as a high risk area, whether it is a true or false. Okay, just to see the number, 3 containers are positive for larvae and we inspected 10 containers. So 3 divided by 10 into 100. Okay, it comes around 30%. That means it is on a high risk area. So answer is true. And who are all high risk population for this infection? Yes, it is infants, elderly, obese people, pregnant people, peptic ulcer, hemolytic diseases, menstruation. Why these people are high risk? Because this infection causes a hemorrhagic manifestation and also plasma leakage. So, if a patient is having an hemolytic disease, his cell lines are already will be depleted. Because of this infection, it will cause a more severe infection in them. If the patient is taking an is in peptic ulcer, it will cause the more complicated. The dengue virus can split as three types. One is dengue fever, next is dengue hemorrhagic fever, and third will be dengue shock syndrome. As the line progresses, the severity also increases. So this population, which I depicted here, are having a high risk for getting the severe infection and ultimately facing the mortality. So, as I said, dengue virus can be classified as asymptomatic and symptomatic. If the patient is symptomatic, it can be either undifferentiated fever or it can be a dengue fever. Okay. And second type will be dengue hemorrhagic fever with the shock or without shock. And last will be expanded dengue syndrome. Now we'll see in short about how this disease manifests. Okay. For example, dengue fever. The classical symptoms of dengue fever will be periorbital pain, retroorbital pain, that is the pain when the patient is moving, rotating his eyeball, he will have the pain. That is a very classical symptom of this dengue virus infection. Okay, retroorbital pain. Another manifestations are headache, myalgia, arthralgia, are all the other symptoms of dengue fever. So if the patient complains of fever for 2 or more days with arthralgia, myalgia, classical symptom of retroorbital pain, you should suspect it might be a dengue fever and you should run the battery of investigation to confirm the fever. Okay. In a few cases, it may manifest as dengue hemorrhagic fever. Dengue hemorrhagic fever means the patient may project with some bleeding manifestations like petechiae or ecchymosis or even a spontaneous bleeding like epistaxis or black tarry stools are all the manifestations of dengue hemorrhagic fever. If the patient reports the late end, there's more severe stage. Even the patient may present with dengue shock syndrome. The patient will be in shock, that is circulatory shock. There'll be low blood pressure, that is even the pulse will be weak, will not able to record the blood pressure, or the cold clampy limbs, etc. All the signs of dengue shock syndrome. Okay. Now we'll see the how this disease progresses in phase wise. Once a person is infected with this dengue virus, okay, day 1, 2, and 3, the patient will be facing the hyperpyrexic state. Okay, the disease may project to a temperature of around 40 degrees Celsius. At the end of second or third day, the temperature settles down and comes to the apyrexic state. Okay, that is the first stage. During this stage, the patient will not have any complication symptoms or signs. Only the symptom the patient will be facing is dehydration. On blood level parameters, there will be a leukopenia and hematocrit gradually rises. Okay, normal hematocrit will be 35 to 45% and it gradually rises 5 to 10%. There will be a rise in the hematocrit value. And as I said, leukopenia will occur. It will be less than 5,000 cells per cubic millimeter. And platelet also gradually decreases. Okay, it will be less than 1,50,000. And when we see test for the antigenic thing by any methods like RT-PCR or any ready-made kits are available. NS1 antigen kit is a ready-made kit where you can diagnose infection within fraction of few minutes. In this stage, if you apply such investigations which test the antigenic level, it will be positive. So this is called as febrile phase. This febrile phase, after the period of 48 to 72 hours, will progress to a second stage called as critical stage, where the vascular permeability will increase. Once this vascular permeability increases, the patient will project with all the bleeding manifestation, hemorrhagic manifestation, and evidence of plasma leakage like ascites and edema, etc. The patient will be projecting. Okay. So, Whether this will be an end stage? No, there's other stage. Okay, once the patient is not immune or his immune system is weakened, it may progress to the profound shock state and will lead to the death. In case the patient immunogenicity is very good, means after a period of 40 to 72 hours or in this stage, the patient will recover back and his vascular permeability will decrease and there will be gradual reabsorption of the extra cellular fluid and the patient will have end in the recovery stage. That is a third stage. In the third stage, patient will be in good state. That is, his appetite will be back to normal. Its hemodynamic status will become to normal. And what is the blood parameters change will be noting is platelet level starts to rise, hematocrit levels starts to decrease. Okay, platelet level will increase, hematocrit level will decrease. This shows a positive sign that is patient is coming in recovery phase. These are the three phases in dengue infection. So how will you confirm the case? Okay, we can divide the case as probable case and confirmed case. For coining a patient as probable case, these are the three parameters. We will follow a criteria called 2+1 criteria. What is this 2+1 criteria is either in the things that is listed, two should be present. Two conditions should be positive. For example, the patient should have an acute febrile illness, should be hyperpyresic for at least 2 or more days with either of the symptoms like headache, retroorbital pain, myalgia, arthralgia. Yes, rashes are also present in measles. The classical description of this rash in dengue is called as islets of white in the Red Sea. Islets of white in the Red Sea is the classical description of the rash in the dengue fever. Okay, it will be maculopapular lesion and there will be hemorrhagic manifestation, isolated petechiae, etc. will be there. Okay, either leukopenia or WBC will cells will count less than 5,000. Thrombocytopenia platelet will decrease less than 1,50,000 and hematocrit value will start to rise by 5 to 10%. Either of these two conditions is present with of this one. One will be next one will be either the patient should have a supportive serology. That is antigen should be positive by NS1 method or ELISA or PCR. Any one method should have the antigen should be present. Or any confirmed case is present within the same location of the case. As I said, this vector flies ranges 400 meters. In case his neighbor is positive for dengue, we can even assume that he might be also having a probable dengue fever. So this is a probable case. He should have two criteria of the thing listed in the left and you should have one criteria that is listed on the right side. How will you confirm the case? If the patient is falling under probable case, we should have a supportive evidence by either isolating the virus from the mosquito. That is usually not done now. It is for the research side we are doing. The second criteria will be fourfold or greater increase in the IgG level. We will be testing the antibody level by ELISA method or PCR method. Or we will be either detecting the dengue virus antigen by NS1 antigen method. Or we will be even doing the genomic sequences using a PCR technique. Okay. So if this is found to be positive by anyone, it is positive, means it is a confirmed case of dengue fever. Okay. So we now just now finished only the dengue fever. The second thing is called as a dengue hemorrhagic fever is there. Okay. Okay, next will be dengue hemorrhagic fever. For this, what will be the clinical manifestation is the patient will have the hemorrhagic manifestation signs like positive tourniquet test. What does it mean by positive tourniquet test? Is we should tie the BP curve and see record his systolic pressure and diastolic pressure first. Then we should set the blood pressure range in the midpoint of the systolic and diastolic. For example, the patient's systolic blood pressure is 120, diastolic is 80. We should inflate the cuff to the range of 100 mm of Hg and we should hold it for 5 minutes. Then we should mark an area in our forearm measuring 2.5 centimeter in length and 2.5 centimeter in breadth. If there are around 10 petechiae spots within the 2.1 inch area, that is called as 1 inch area. If there are around 10 or more petechiae spots in that area, then the tourniquet test is positive and we can say the patient is having a hemorrhagic manifestation. Sometimes a patient even manifested with the petechiae spots over his skin or ecchymosis or purpura or even the bleeding manifestation from mucosa. The patient may complain that during morning brush or the personal hygiene period, he may have some bleeding manifestations. Okay, that case also we can suspect it is an dengue hemorrhagic fever. Third criteria will be plasma leakage. For example, as I said, there will be increased vascular permeability in this dengue fever. Because of this increased vascular permeability, the patient may have the pleural effusion, there might be ascites. All this indicates the plasma leakage signs. And in the dengue hemorrhagic fever stage, the platelet level may even fall below less than 1 lakh. This all indicates the patient is in the dengue hemorrhagic fever. Next, we'll come to the dengue shock syndrome. That is the third critical stage, where the patient will project with all the signs of dengue hemorrhagic fever with tachycardia, cool extremities, delayed capillary filling. And when we record the pulse pressure, that is a difference between diastolic and systolic pressure, it will be falling less than 20 mm of Sg. That is, diastolic pressure will be increasing, systolic pressure will be decreasing in the case. And we can even see the patient is on the hypotension. For hypotension, the measurement that is given is if the patient falls less than 5 years of age, if it is systolic blood pressure is less than 80, it is hypotension. If the patient is 5 or more years, the blood pressure is below 90, is called as hypotensive. So if the patient is fulfilling this criteria, he'll be calling us dengue shock syndrome. Okay. There's also another staging called WHO staging where there are 4 grades are given. Okay, first grade will be dengue fever with hemorrhagic manifestation is the first grade. Second grade will be dengue hemorrhagic manifestation with evidence of plasma leakage. That is a second stage. Third grade that is they given is spontaneous bleeding. Fourth grade that they are given is profound shock. Okay, they are classified the dengue fever into 4 grades. Okay, if the dengue fever with hemorrhagic manifestation is a dengue grade 1, hemorrhagic manifestation with the evidence of plasma leakage is grade 2, with the spontaneous bleeding is grade 3, and fourth will be the profound shock. Okay, why this staging is important? Because based on this staging, the treatment management plan will be there. That is, we'll see in next successive slides. So now we'll come to the laboratory diagnosis. If the patient is having the symptoms reporting less than 5 days, we can test the antigen levels by either NS1 antigen, ELISA, or PCR technique, as I said. If the patient reports with the symptomology of more than 5 days of duration, we can go for the antibody testing, either by ELISA or by rapid test, any methods, and we can see for the antibody levels. By either of those 2 methods, we can confirm the dengue fever. Now I'll explain a scenario, okay, where a scenario is an 8-year-old girl, Sanjana, who's admitted in the ward with the symptoms of fever for 5 days. He's having abdominal pain. See, she's presenting with black tarry stools, okay. And a doctor is making a visit, the physician is making a visit. She was found to be lethargic. Her extremities were very cold. And pulse pressure is less than 12, that is of 12 mm of Sg. Her blood pressure is 20/64. In this case, what will be your diagnosis? See, the patient is having a fever for 5 days duration. Next, hemorrhagic manifestation is present, that is black tarry stool is present. And she's having a cold extremities that shows the blood perfusion is low and her pulse pressure is 20. So this is a case of dengue shock syndrome. Second scenario, a boy is reported in a PHC with the symptoms of fever, classical sign is retroorbital pain, and he also says that in the same premises, one more patient is positive for dengue. So what is this diagnosis of this case? Yes, it will be a probable case of dengue because he's having a symptom and also his neighbor is positive for dengue. So it's a probable case, it to be confirmed by serology method. Okay. So now we come to the clinical management. So dengue fever will be mainly an symptomatic management. Okay. We'll be giving oral deodorization solution and symptomatic management, like to treat hyperpyrexia, paracetamol will be given, and we'll be explaining the patient about the warning signs of hemorrhagic manifestation, shock, dengue shock syndromes. What are the clinical signs that will be visible? We'll be explaining to the patient and we'll be sending to home. In case patient is having the hemorrhagic manifestation, we should admit the patient, and the treatment will be same symptomatic management with ORS and IV fluid replacement. The preferred IV solutions will be crystalloids and colloids. The crystalloids will be normal saline or ringal lactate. The colloid will be dextran or polycellate. Okay, then we should watch for the shock signs. What are the shock signs? Same, cold extremities, low pulse pressure, hypotension. Okay, we should watch for this. If the patient falls grade 3 or grade 4 of dengue, in that case, we should assess patient on 24-hour basis, that we should have critical care management to the patient. And in some cases, there may be a blood transfusion needed for the patient. Okay, in that case, we should transfuse the blood. The packed RBC will be a good preferred choice. And in some cases, the platelet level fall less than 10,000. In that case, we'll be transfusing the platelets to the patient. Okay. So what is the indication for blood cell transfusion is when the blood loss is more than 10%, we'll transfuse the blood for most probably whole blood or packed RBC. If the platelet level falls less than 10,000, we'll be giving the fresh frozen plasma. Platelet transfusion will be done. So this will be typical management of dengue. Though I said in short, this will be in detail explained in PARC textbook with flowcharts. If you happen to have the textbook, just to go through it. So now we'll come to the next part, that is prevention and control of dengue. We study in detail about the epidemiology, that is what is the agent, what is the environment and host. We could have come to the conclusion that if we control the vector, okay, if we control the Aedes vector, the chance of spread of this infection will be reduced. Okay. So for that, what are the measures that could be taken? We'll see in detail. So for this, a national program is running. That is a national program name is National Vector-Borne Disease Control Program, under which 6 diseases concentrated. So when we come to the integrated vector management, the important steps will be epidemiological surveillance and entomological surveillance. Okay, entomological surveillance, as I said, I explain in detail to you about the 3 indices. That is about only larvae. There are also other indices for pupa and adults, like biting time, resting time, and there are plenty of surveillance technique. Even I said no, the viral isolation, where they will do in the help of mosquito, they'll be doing the viral isolation techniques. It all comes under the entomological surveillance. Okay. Epidemiological surveillance is about the number of cases reported, what is the morbidity, what is the age of the infection, infected population, what is the mortality, etc. will be in the epidemiological surveillance. In NVDCP program, there will be 6 diseases that is covered. One is malaria, dengue, chikungunya, Japanese encephalitis, followed by filaria and Kala-Azar, of which one of the diseases dengue. Okay. Under integrated vector management, what are the things that we need done? One is we know the vector Aedes, if we control the disease progression will be decreased. So for that, anti-larval measures can be taken. What are the anti-larval measures? As I said, environmental control. In environmental control, there will be 2 things. That is, we should manipulate the environment such a way that the breeding places of mosquito will be not present in the proximity. For example, if you are having a tree shade, construct a tree shade such a way that I depicted in the picture on the right side, in a slopey fashion, so that water will not be stagnant in the sunshade. In that case, the breeding place also will not be there and the vector population also decrease. It's like that environmental manipulation technique should be made. Second thing is by chemical control using some insecticidal spray or not spray, just mix the insect Paris green, etc. Mix in water so that the larva will die. Third thing will be biological control, where the Gambusia fish will be used to the in the water ponds where the vector for larva of the Aedes is present, it will take care of it. So the three things will be either we can do the manipulation of environment, or we can use some chemicals in the water that where the breeding place of the larva is present, or we can even use the biological controls like Gambusia fish. Second will be adult. Now we are dealt with only with the larval stage. Larva will be followed by pupa and adult. So adult stage, how we are going to control? It is mainly by the residual spray. Okay, it can be even the indoor residual spray, that is, for example, malathion, uh, etc., can be used to control the mosquito. As I told, this vector Aedes is endophagic and endophilic. Endophilic means it resides in endo environment. So this residual spray will work well in that scenario. Okay. Then even space sprays can be used. Okay. Space sprays, as I showed in the third picture on the right side, during after rainy seasons, we could see this type of fogging in the vehicle they'll be doing. This is called a space sprays. Okay, this all very short term measure. That is, the effect of this will be only for next 24 to 48 hours, not a long term. Okay. Third will be genetic control. If you are very interested in this to know about this now, just read about the thing which I will say Wolbachia project that is done in Australia. It is also done in our own Pondicherry in VCRC. The name of the project is Wolbachia, where they will sterilize the male population so that the next progeny will not develop, and thereby infecting a bacteria called Wolbachia. Okay, so that the infected mosquitoes, next generation, or the thing will not happen. So the virus transferring transmission will be interrupted. Okay, this is a basic concept which I explain in short. If you are interested, get back and read about the Wolbachia project. And third thing, we are dealt with the larva, we are dealt with the adult. Now we need to protect by ourselves now. So what are the personal protection measures? That is mosquito net, screening and repellents. Okay, mosquito net, we can, bed nets can be used, insecticide treated bed nets can be used, or even the screening of the windows, etc. can be applied, or we can even use the repellents, that is tolbutamide, which are using as all out good night, etc. can be also used. There's also a vaccine for this dengue. It is called a CTD, TDV. It is an approved vaccine. It is not available in India, but it is an approved WHO vaccine. It is a live vaccine. It contains all the 4 serotypes. So this vaccine will protect for all 4 serotypes. And it is a 3-dose vaccine. Okay, it is a 3-dose vaccine. It is given in 0.5 ml at 6-month interval in subcutaneous route. And this infection is recommended to children? No. This vaccine is recommended for the population of 9 to 60 years of age. Okay. So this is in short about this vaccine. And it is a live vaccine, so it is contraindicated to the immunocompromised state, such as HIV, etc. It is contraindicated, and even pregnancy it is contraindicated. Okay. The effectiveness of this vaccine in trial is found to be 85%. Okay, the vaccine name is CTD TDP. So, in short, our topic of discussion was about the epidemiology. What is the agent causing it? What is a vector? How it is transmitted, etc. Then we assess the risk of an area by 3 indices: house index, container index, and Brito index. Next, we come to the manifestation of dengue fever. That is mainly dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. And how each one will be presenting, that we discussed, and how to diagnose each condition, whether the patient is in dengue fever or in DHS, dengue hemorrhagic, or in dengue shock syndrome, and WHO grading we had discussed. And we also seen in short about how to manage each grading, how to manage grade 1 and grade 2, how to manage grade 3 and grade 4. Yes. Next, we are come on to the control measures, where the important concept will be vector control. So, integrated vector management, we have seen anti-larval measure, anti-adult measure, followed by personal prophylaxis. Then we also saw about the vaccine for dengue. Okay, this ends the major important discussions in dengue virus infection. If you could solve this MCQ, it would be like a revision. What is the vector responsible for transmission of dengue? You could answer this. Second, what are the characteristics of dengue? It's a total, all the options shown here, or a characteristic. Only one is not the characteristic of the Aedes. What is that? It will be exophilic and exophagic. Okay. All the other three are characteristics of Aedes. Third, all of the following are seen in the critical phase of dengue, except, okay, the temperature increases. No, the critical stage starts with the once the temperature settles down. Okay, hematocrit will increase. Platelet will start to decrease and fall less than 1 lakh. IgM and IgG also will start appearing. Antibody also will start appearing. So correct answer will be option A. All of the following are seen in dengue hemorrhagic fever grade 1 except dengue grade 1 is dengue fever with dengue hemorrhagic fever. Okay, dengue hemorrhagic manifestations. So positive to negative test is hemorrhagic sign, so it is positive. Pleural effusion, yes, it will be. Whether it will be seen? No. Pleural effusion is an evidence of plasma leakage. It is a grade 2. So option B is the correct answer for this. Last, which one of the following is anti-larval measure? We have seen three measures. So which is anti-larval? Residual spray is anti-adult. Repellent is anti-adult. Genetic is, yes, genetic. What is genetic? Either it's genetic or biological. If you want to revise, just take over this. Now you could come to answer, I guess. Yes. Option will be D. Last. Choose a false statement regarding CTD vaccine. CTDV vaccine. What is a false statement? Yes, it is given in subcutaneous route. Whether it can be given in all age group? No. Between the age span of 9 to 60 years. Yes, live activated. It is a live activated vaccine. It's a tetravalent vaccine. Okay. This ends our session. At the end, each year, National Dengue Day is observed. It is on 16th of May. Okay, each year it is on observed on 16th of May. Yes, thank you. Have a good day.